Hey guys, it's Dr. Justin Marcagiani here. Today we are live. I did a couple of podcasts today already, so I've been in the trenches, looking at the research, looking at the data. Really excited to interact with y'all and answer your questions. What is up? All right, let's continue to roll here. In a recent video by Dr. Chris Masterjohn, he recommended not taking high doses of vitamin D and A as they upregulate the ACE2 receptor, which coronavirus binds to make the infection worse. Yeah, I mean, it depends what you mean by vitamin A and D high levels. I think with vitamin D, I think taking moderate levels, there's been some data on acute respiratory infections, vitamin D being very helpful for it. I don't see any data right now on vitamin D being harmful. Again, it's a novel virus. I don't see any data on it being harmful. I think that recommendation is more theoretical than it is, research driven. But there's, lots of articles on vitamin D with acute respiratory infections. And I think, keeping it to more natural levels, so like closer to like maybe 5,000 IUs on vitamin D would probably be safe. 1,000 IUs per 25 pounds of body weight is pretty safe. And vitamin A, you can always keep it more on the food source side of the fence. But I mean, a lot of vitamin A studies on healthy epithelium cells, healthy immune function on vitamin A. I understand the ACE receptor site is effective, but I think there's no data on saying that these things are contraindicated, meaning you'll do worse on these things with this virus. I think it's more of a theoretical assumption than anything else. Why are many people saying elderberry is contraindicated for C19? I think people are worried about a cytokine storm because of the cytokine immune response that can happen from elderberry, but there's no data at all showing that that's the case. So, some of these nutrients are going to help modulate or upregulate the immune response to attack a lot of these things. And I think they're concerned about too much of an immune response, but I think that's more of a theoretical thing. I have chronic rhinosinusitis. Swabs are positive for macrons, or I think Marcons, really. I mean, BEA, so the beg spray, that's like the erythromycin spray to combat the macrons without resolve. Could a GI map or other function test be helpful at finding a root cause? Yeah. Anytime you have like an infection in like the mucous membrane area, you have to look at the gut for sure. I mean, I will typically do a lot of sinus flushing with sea salt and xylitol to help kill any biofilms or bacteria or fungus, which is helpful. But we really want to make sure we fix the underlying gut, because the gut is where 80% of the immune system is. And of course, foundation, healthy diet, healthy digestion, make sure the hormones and the inflammation's regulated there. That's important as well. And then diving into all the gut stuff and all the healthy fun stuff there. Okay, excellent. Is adding baking soda to saline in a nebulizer okay? I'm not sure. I'm not sure about adding baking soda, probably because a lot of the glutathione that I have, it's mixed with a sodium bicarb, and I'm pretty sure baking soda is just pretty much bicarbonate, right? Pretty sure that's the case. Dr. J, a psychiatrist, informed me that psychosis that goes untreated can lead to dementia. Is that correct? I'm not aware of it. I'm not aware of that. In general, what are the underlying symptoms that are causing psychosis? So when you look at what's driving psychosis, inflammation in the brain, a lot of times key B vitamins, B6, B1, B2, B3 are very important. Amino acids are very important for brain chemicals. Also, high quality fat soluble vitamins, cholesterol is a lot of really important building blocks. So if your diet's just crap, that's one potential root cause. So of course, if that's the root cause and you don't fix it, I mean, your health's going to go worse in a lot of different directions because your nutrition's poor. And then, of course, getting the inflammation under control, if it's from food or diet or stress or from infections, all that could be part of the root underlying issue. Would you up your recent recommendations, supplement dosing, if you found out you were to have coronavirus? If so, what dosing? Well, it depends on what. I mean, I think vitamin D, you can always stick to a reasonable amount, up to 5,000 IUs. I think you can go up to 10,000 IUs. I wouldn't see a problem with that acutely. It just depends. Are we talking acutely or are we talking chronically? Acutely, unless your vitamin D levels are over the top saturated, which most people aren't, you're probably going to be safe upping your vitamin D acutely. So keep that in the back of your head. I'll pull up one study here if I can on vitamin D and respiratory infections. A lot of info about that today. I saw it on my Facebook feed. Let me go pull that up here, because that came up with some really interesting stuff. Let me see if I can grab that. Yeah, vitamin D. Yeah, here it is. British Medical Journal. Boom. Let's go look at this. All right, let me pull it up on screen here so you guys can see it. Okay, let me pull this up. Ready? Boom. Okay, take a look. So it's a meta-analysis looking at vitamin D supplementation to prevent acute respiratory tract infections. Now, this could be infections from flu, rhinovirus. It could be from adenovirus, paramyxovirus, any of those kind of viruses, right? But this is a meta-analysis. So it's looking at many different studies and trying to look at the general trend from all the studies. And here, vitamin D supplementation was safe, and it protected against acute respiratory tract infections. Overall, patients who are very vitamin D deficient and those not receiving bolus doses experience the most benefit. Patients who are vitamin D deficient and those not receiving bolus doses. So, I mean, I would generally recommend getting your vitamin D levels up to 50 to 70 or so is probably fine. If you're doing amounts above that could throw you over the top, maybe that's going to be too much. Maybe you're going to have some negative impact. I think if you keep your vitamin D levels within the normal physiological range, you're probably going to be fine. I don't see an issue there. Great questions, though. I have oral thrush and started a month-long nystatin treatment. Would that be enough? And do you recommend taking a probiotic while doing the treatment? Yeah, I would definitely be taking a probiotic by doing the treatment for sure. I'd also address the gut. So if you're having dysbiosis, or I should say thrush in the mouth, I would be, using some kind of a really good essential oil mouthwash, whether it's a Thieves or a Young Living, kind of On Guard or On Guard or Thieves is great. I'd also address the gut. Any microbes or dysbiosis or fungal overgrowth in the gut can easily spill up the tract, so to speak. And I would definitely be adding in higher doses probiotics like Bifidobacter, Lactobacillus. I'd even do a lot of Saccharomyces boulardii. So in my line, we would use something called ProbioFlora, which is like a Bifidolactobacillus, 12 plus species, and then a Saccharomyces or Sacroflora, typically 4 to 5 caps a day on that would be great. Okay, excellent. I had a blood test recently. They told me I was very deficient in potassium. I've been tracked by my nutrition, and I thought I was consuming more than enough. And I was curious how this is. Well, most people don't get enough potassium. You can go run it through a chronometer. You need about 4,500 milligrams a day of potassium. So you can count that out on chronometer, justinhealth.com/chronometer, CRONO meter, METER. About 4,500 milligrams a day. So you get about 500 or so milligrams per serving of green vegetable, about 1 gram per avocado. So about 6 servings of vegetables, 1 avocado, and 1 sweet potato will get you there. People that have more adrenal dysfunction will dump potassium. They'll dump it, they'll pee it out. So if you're noticing like more cramps, things like that, then definitely add some extra potassium. You can do a potassium bisglycinate or a potassium citrate. Those are really good extra ways to get it outside of just doing more green vegetables or avocado or those kind of things. Okay, excellent. Great question, though. Thoughts on krill oil? I think krill oil is good. I mean, it's got a phospholipid bond in there, so EPA and DHEA is less. I like the idea of getting a little bit more of a dose of EPA and DHEA. I mean, the mindset is, well, you got the astaxanthin, the antioxidants, you got the phospholipid, so you don't need as much EPA and DHEA, but I still like the, I lean on a good fish oil or a good cod liver oil, but good data on krill as well. I'd probably rotate it. I wouldn't just rely on that only. Do you think diffusing oregano oil will have any benefit for coronavirus? You could definitely diffuse maybe a drop, like 1 drop in an ounce or 2 of saline or water. Make sure it's filtered though. You could do some tea tree or melaleuca or like an On Guard, maybe like 1 drop. It had to be very diluted because essential oils can burn. But you could do a single grapefruit seed drop or like 1 tea tree oil melaleuca drop, but that'd be it. If not, I lean more on the nebulized glutathione that's water soluble, that's blended with the sodium bicarbonate and will be diluted. What they call it? Will be a good solute. It'll be soluble within the water. You're welcome for the answer. Excellent. Krill versus cod liver oil. I'm having a tough time finding cod liver oil. So I like cod liver oil for the vitamin A. Vitamin A is excellent, high quality vitamin A. Nordic Naturals and or Carlson's will be the best brand on that. They all come from like Scandinavia, Norway area. Usually higher quality, less contaminants as well. So I did a couple of chats today on the coronavirus, just kind of looking at statistics, just so people don't lose their brains. Okay, so death tolls, right? I always like to compare things to known death rate. So influenza is a really good one, right? About 400 to 500 people die a week of influenza. It's good comparison. A lot of people. Flu takes a lot of lives. Then we compare it to where we're at on the coronavirus side. Let's go look at United States. So daily deaths, we're at 117 yesterday. I think we're a little bit less today. So you can see on the graph here overall where we're at. Oh, where's our bell curve? Here's our bell curve. So we're down a little bit today. So let me go back here one page. Let me go back here. United States. Let's do this. Let's see where we're at. Total deaths. Okay. So here we are, USA. So we're plus 93 today. Plus 93 today on the graph. Where does that fall here? So we're still, I'm hoping this, because the general trend of virus follows is usually a 1 to 2 month bell curve. So right now we may be at the top of the bell curve in the next couple of days to a week. So right now we're a little bit below. We're like right here or so today based on today's data that's not quite in there, right? United States, we're at 93. We look at the data set, we're at 117 yesterday. So we're like right here where my mouse is. So I'm hoping that starts to drop. You can see Germany's already rounding the curve. Germany's already coming down. Right here, they're coming down the curve. Look at China. China's coming down the curve. They're at the very bottom, obviously. Look, daily new deaths, they're right at the very bottom, which is nice. So is South Korea. South Korea's coming. They had a couple of pops right here, but they're still generally heading downward. And if you look at their daily rate case, you got to look at the curve because viruses typically follow a curve like this. They go up and they go down, and we're trying to flatten this curve because here's where the healthcare system's capacity is. So the goal is to try to do this. Flatten that curve and keep it under the system's capacity, if that makes sense. So really important that we're on top of that. But I mean, one thing I always say, you got to look at trends when you're looking at the data. When you're looking at this right here, it's kind of like a little bit scary. You're like, okay, look how many deaths we have. 512 is how many we have people pass for flu in 1 week, and we're about 3.5 weeks in. So it's still very good. We're about probably anywhere between a day or two to a week and a half from being at the top of the curve based on the data. Maybe a week and a half, maybe a day. What do I mean by that? Took China about 3 to 4 weeks from being at the top of the bell curve. Look at Germany. I mean, Germany's killing it right now. They're like right at the top of that bell curve in like 2 weeks, 2.5 weeks. So I'm hoping that we follow that line in regards to the data trend. So that's kind of where we're at. See, any questions come in, guys? See, any questions come in? Hope you guys like me putting images on the screen. I feel like I can get my point across a lot better. Concerned about taking my ACE inhibitor right now. Anything else you recommend for HTN? I mean, it just depends. If you have higher blood pressure, I would lean more on magnesium or potassium. Those would be good things to kind of just naturally help lower your blood pressure. So I'd try to get to the root cause. If you're taking an ACE inhibitor for high blood pressure, try to get to the root cause. Try to get your diet in check, get your insulin levels in check, get your inflammation down. Usually too much insulin surges, too much inflammatory foods, too much omega-6, not enough magnesium, not enough potassium. Those things can drive a lot of blood pressure issues. So I would look at that. I'd look at that, and because I know that the coronavirus is using that ACE receptor site, and I know the ACE inhibitors work on that. They're designed to help reduce renin-angiotensin. Sebastian writes in Dr. J, what foods or herbs do you recommend to get rid of phlegm in the chest? I keep coughing, but the phlegm is stuck. Great question. All right. So number one, ginger tea is excellent. It's a really good anticoagulant, really good anti-inflammatory. Number two, you can always do some nebulized glutathione. Go get the special kind of glutathione. Go watch my video on YouTube on that. And then number three, N-acetylcysteine, 2 grams a day. It'll help filter out and dry up all that mucus. N-acetylcysteine. You can also get an herb called guanefacin. Guanefacin is the active ingredient in Mucinex. It's an active herb in Mucinex. And then you can also follow my video on how to do nasal or sinus rinsing. We do the minerals. We do the sinus rinse bottle. We add the xylitol to it, and that really flushes things out, kills biofilms. And the NAC will really, really dry things up. Very helpful. The guanefacin also dries it up as well. Good question. All right, let me keep on. All right. Yep, so food, herbs, yep, good. And I keep coughing and the phlegm gets stuck. Yeah, so make sure you also avoid dairy or any inflammatory foods that could be more mucus forming. Keep an eye on that. Do you have any comments on a carnivore diet, which seems to be popular right now? Yeah, I've done a couple of videos on the topic, but in general, a carnivore diet for people that are very sensitive to animal or say plant-based nutrients or plant products or the anti-nutrients in plants like the polyphenols, the salicylates, the oxalates. These are like anti-nutrients that are in plants. Now, when you cook these things down, they tend to be pretty benign. You can try to choose more paleo or autoimmune paleo versions, lower FODMAP, cruciferous-based ones, avoiding a lot of the nuts or seeds or nightshade vegetables can be helpful. But some people with a lot of autoimmune stuff, they do better. They really do better with it. If you're going to go carnivore, choose high-quality cuts of meat. Avoid lean cuts, choose high-quality cuts, grass-fed, organic. You get a lot of plant-based nutrients from the animals that are when they concentrate them up. It's very important. Okay, excellent. Great questions, y'all. All right, anything else, feel free and let me know. Did a lot of videos on boosting your immune system and the coronavirus. I want to cut out a lot of hysteria once you compare it comparatively to other conditions and outbreaks we've had over the last 10, 20 years. We're not in rough shape. We really, really aren't in rough shape. I think we're on top of this thing. I think, the most important thing is boost your immune system, boost your immune system, quarantine if you're at that age or you have health compromise or you're, once you're 60 and up, quarantine. I think also do all the good things regarding washing your hands. If you're immunocompromised, quarantine. If you're healthy, you can still do some social distancing. I think it's smart for at least 2 weeks just to compress that bell curve, right? Remember the bell curve here? It's more about this. All right, I'm doing a lot of social distancing and or quarantine more to keep this curve flattened. That's the big thing, not for me. I'm doing things to boost my immune system, right? I'm doing a lot of the vitamin A and some vitamin C and doing some medicinal mushrooms, and I'm on top of all my nutrition, and my diet's basically perfect, as organic and as clean as possible. So I'm doing things to upregulate my immune system. No one's talking about boosting the general public's immune system. Okay, washing your hands and social distancing does not increase your immune system. That's the problem. Don't get me wrong, it takes stress off the immune system because if we're getting microbes coming into our body because we're not washing our hands or we're getting exposed to sick people, yeah, that's going to be a stressor, but we're not doing things to upregulate our immune response. Just keep that in the back of your head. All right, any other questions, y'all? Feel free to let me know. If not, I'll be back maybe later on this week. We can stay in touch and talk about what is on in your mind, and I'll keep y'all updated with the coronavirus and what else is happening. All right, y'all, if you enjoy it, thumbs up, comments down below. Let me know your experience so far, things that are helping you with your immune system. If any of you all are getting the coronavirus or having symptoms, put it down below. Let me know what you're experiencing, how the whole testing process is. Really curious to get that behind-the-scenes intel, and I'll be back for more. And if you guys enjoy, thumbs up, subscribe, hit the bell, and I'll be back. All right, take care, y'all. Bye now.